Welcome to TCM Board Formula Series. Today we review Yang Huan Wu Tang, Tanifa the Yang to restore 5 decoction. It belongs to the category Tanifa Qi and invigorate blood. The herb photograph shows Huang Qi, dried astragalus mung holicus root slices. The fastest memory hook is this: a large dose of Huang Qi supports deficient Qi while a small blood-moving team opens the channels. By the end, you should recognize the core ingredients, formula hierarchy, pattern picture, major differentials, and modern safety checks. This lesson is for board preparation and professional education. It is not a diagnosis, prescription, or substitute for individualized medical care. Build the formula from its ingredients. Huang Qi strongly tonifies Qi and supports movement through the channels. Dang Gui Wei nourishes and moves blood. Shao cools and invigorates blood. Chuan Xiong moves Qi within the blood. Tao Ren breaks blood stasis. Hua invigorates blood and opens the channels. Long unblocks the channels and supports movement. On an exam, do not memorize the list as isolated names. Link each ingredient to the treatment strategy. The composition should explain why the formula fits its pattern and why a similar formula does not. Now organize the hierarchy. The chief is Huang Qi. The deputy level is Dang Gui Wei. The assistants are Shao and Chuan Xiong and Tao Ren and Hua. The envoy role is Long together. The formula tonifies Qi, invigorates blood, unblocks the channels. A useful board habit is to ask what the chief attacks or tonifies, what the deputies reinforce, and how the assistants control side effects or protect the middle. The target pattern is Qi deficiency with blood stasis obstructing the channels, classically in post-stroke recovery. Look for this clinical picture: unilateral weakness or numbness, facial weakness, drooling, or slurred speech, fatigue with a pale or dull complexion, chronic rather than sudden neurologic deficits. The tongue is pale or dusky, sometimes with stasis spots. The pulse is deficient, weak, or choppy. The board answer comes from the whole pattern, not one symptom. Match the disease mechanism, the treatment strategy, and the tongue and pulse before selecting the formula. Differentiate carefully. Shuefu Zhu Yutang a Euro blood stasis is centered in the chest without marked Qi deficiency. Zhengan Xi Feng Tang a Euro liver yang rising and internal wind with stronger excess above signs. De Huang Yin Zi a Euro yin yang deficiency with phlegm obstructing speech and movement. When two formulas seem close, identify the single feature that changes the treatment strategy. Ask whether the presentation is excess or deficiency, hot or cold, exterior or interior, and whether phlegm, dampness, food, blood, or sinking Qi is the main driver. Safety is part of formula knowledge. Classical cautions include sudden facial droop, arm weakness, speech change, severe headache, or new neurologic deficit is an emergency. Do not use the formula name as a substitute for stroke diagnosis, rehabilitation, or secondary prevention. Use caution in pregnancy, active bleeding, or before surgery. Modern medication review includes multiple blood-moving herbs require review with anticoagulants, antiplatelets, and bleeding disorders. Huang Qi may be inappropriate with some immunosuppressive regimens. Coordinate with the prescribing team. Use a verified product, document the complete medication and supplement list, set monitoring parameters, and refer when red flags exceed the scope of routine herbal care. Formula names do not guarantee identical composition or concentration across products. Finish with 5 board pearls. Number 1. Huang Qi is the dominant chief. Number 2. Qi deficiency plus blood stasis. Number 3. chronic channel obstruction. Number 4, pale or dusky tongue. Number 5, acute stroke signs or emergencies. The one-line recall is, a large dose of Huang Qi supports deficient Qi while a small blood-moving team opens the channels. Review the ingredient architecture, then practice distinguishing the nearest look-alike formula. This concludes Yang Huan Wu Tang. Save this lesson for spaced repetition, and always connect board memorization with safe clinical judgment.